Are we seeing
Yeah.
any change in symptoms, doctor, in terms of these latest variants, or is it that's, upper respiratory crud and extreme fatigue that we associate with COVID?
So far we've been lucky that the new variants that are evolving, even though they appear to spread more efficiently, they don't appear to make you sicker. They're not more what we call virulent in the sense that they end up more people in the hospital. Most of them are presenting with those same upper respiratory tract symptoms that we've seen. But here's the kicker: the more the infection spreads, the more the virus has a chance to mutate. And we saw that back in the pandemic, where more and more people were getting the infection, and that was causing the virus opportunities to mutate and change. We had the Delta variant, we had many of the earlier variants. So my fear is heading into this winter season, if most of us are not vaccinated, most of our natural immunity has waned, we're giving that virus lots and lots of chances to mutate and become something worse again.
Dr. Kohli, I keep hearing about how important it is for kids age 2 to 5 to get vaccinated. Why?
I would say that being in extremes of age, whether it's the young kids or whether it's the older individuals, that's one of the biggest risk factors. Certainly, kids 2 to 5 are one of the most efficient vectors of spreading upper respiratory tract infections. They go to school, they go to daycare, they're very efficient at getting infections and not very good about hand hygiene. So it's important to protect them. But Allison, even kids under the age of 2, more than half of them ended up in the hospital with the COVID infection. So being very young, because your immune system is immature and naive, is also a huge risk factor and puts a huge target sign on you. And the CDC this year is not recommending routine vaccination for kids under the age of 2, whereas, of course, we know the American Academy of Pediatrics has come in with the opposite recommendation, that if you're 6 months to 2 years, you should definitely get vaccinated.
Doctor, how worried should we be about the language coming out of the CDC and the changes there?
As an American, I'm worried. And as a physician, I'm even more worried. And the reason is because the language is confusing, the language is contradictory. You've got the American Academy of Pediatrics, the Infectious Disease Society of America on one side, you got the CDC and the FDA on the other side. So the average American is really left to fend for themselves and figure out what to do. And it's not clear to them what's the right path forward, where science is leading. So I know for my patients as a cardiologist, I'm telling them, first and foremost, if you're over 65, no doubt in my mind, go and get vaccinated. Really help turn around that vaccine fatigue. If you're under 65, I would still recommend you get vaccinated, especially because, like I said, the virus is continuing to evolve, but you need to talk to your doctor, get a prescription for that vaccine, and try to figure out what your individual risk is.
I'm wondering if we're going to see any change in policy if these spikes continue to grow and we see more serious hospitalizations continue to grow.
That's a really interesting point. And I do think that hospitalizations, infections, time missed from work, all of these will lead to change in policy. But the problem there is that it's a reactive approach, not a proactive approach. We have millions of Americans at risk, and then something bad happens to them, and then we think about changing policy. Now, the good news here is we're in a little bit of a different position than we were in 2020, right? It's not a novel pathogen. Most of us have either had the infection or received at least a few rounds of vaccine. So our immune system is somewhat familiar with it. And we've got effective treatments like Paxlovid that can be used if people get sick. So I do think we're in a better position than we were 5 years ago when we first met COVID. But it still makes me very nervous because the vaccines is what got us out of the pandemic. The virus evolving to become gentler is what got us out of the pandemic. And now we're sort of turning our back on that.
Dr. Kohli, I'm so glad that you pointed out the difference between now and then, because so many people still have some level of PTSD from that whole experience of this global pandemic and people having to stay indoors and separate from their loved ones. And so are you saying that there is not a big chance for this new strain to become a pandemic level the way we saw it?
Definitely not, Allison. I think it's highly unlikely because a pandemic, by definition, is a novel pathogen that spreads globally. So we already kind of know this pathogen. What we could see now is surges and waves, and those could be pretty big waves that could really impact our quality of life, our time away from work, from school, and really put Americans in the hospital. So I'm not saying it's completely risk-free, but I'm just saying that we're not looking at another pandemic here. But we are looking potentially at large surges or large waves of infection, either locally or nationally, that could affect the way that we get through this winter season.
All right, Dr. Kohli, thanks for weighing in here. We appreciate it. We'll see how this develops.